In today's video, I'm going to show you how to fix proximal biceps tendinopathy for good. That's the biceps muscle right here. Tendinopathy occurs in the tendon right here where the biceps muscle attaches to the bone. In the video, we're going to cover the symptoms, what most people think it is, and the type of treatment you'll get because of that, and what proximal biceps tendinopathy actually is, the root causes. Then we're going to talk briefly about surgery, and finally, I'm going to show you 4 super amazing exercises that you can do at home that will help you to fix this issue. Coach E from Precision Movement here, and before we fix your proximal biceps tendinopathy for good, I just want to mention one thing that my team and I have been really hard at work on for a while, which is our new version of ROM Coach. It's going to have a completely new interface, new user interface, but most importantly, we've rewritten the code from the ground up because we've got some big plans in the near future, in the next few months, that we needed a strong foundation to build upon. So that should be coming out within a few weeks. So if you want to check out the old version, the content is going to be all the same at the beginning. You can download it here, or we'll put a link in the description below. And then when the new version launches, you'll see that evolution live. Now let's get to fixing your proximal biceps tendinopathy. Now what's the difference between tendinopathy and tendonitis? Well, tendonitis is just the acute phase where you have that inflammation and pain in the same area, but it hasn't become chronic yet. When it becomes a tendinopathy, that's when that pain has been around for a long time and the tendon actually starts to deteriorate. So if you've been told you have tendinopathy, you're in that chronic pain stage. One of the most common symptoms of proximal biceps tendinopathy is pain when you're lifting your arm up overhead. So whether you're playing a sport or you're just reaching for something in a high cupboard, that'll cause really painful symptoms there. Other symptoms include radiating pain down the arm, snapping and clicking of the tendon around the groove on the bone, the humerus, and you could also have a lot of problems sleeping on your side. I'm a side sleeper, so if I had this problem, I wouldn't be able to have a good night's rest, and that can just exacerbate things. That's the vicious cycle. What most people think biceps tendinopathy is a problem with the biceps muscle itself, whether that's the biceps is too weak, whether it's too tight, where you'll get stretches like this, or you've just got scar tissue and you just need massaging or ultrasound or shockwave therapy. These are the common treatments that a biceps-focused approach will look like. However, biceps tendinopathy is actually the symptom. It's not the root cause. So what is the root cause? What is creating a problem in this biceps tendon? Before I share my approach to dealing with this and any chronic issue, here's a really good study that gives you a hint as to what's going on. The title of the study is Compensatory Movement Patterns are based on abnormal activity of the biceps brachii and posterior deltoid muscles in patients with symptomatic rotator cuff tears. So we know that if somebody has a rotator cuff tear, then those muscles are going to be weaker than if they didn't have a rotator cuff tear. So something else has to pick up the slack. In this study, the researchers showed that EMG revealed hyperactivity of the posterior deltoid and biceps brachii muscles during the upward phase, that's lifting the arm up, in patients with rotator cuff tears compared with the controls, people who didn't have a rotator cuff tear. And the authors conclude that patients with a symptomatic rotator cuff tear show compensatory movement patterns based on abnormal activity of the biceps brachii and posterior deltoid muscles. From that study, it's clear that the main problem is the biceps is overworking and it's compensating for something else that's not working properly. And what that something else could be the rotator cuff, as in the study, but there could be other things that cause the rotator cuff to not work and do its job properly. One of those is poor thoracic spine posture. When you have poor thoracic spine posture, all of the muscles that stabilize the shoulder joint, the glenohumeral joint, which are the rotator cuff, and the scapulothoracic joint connecting the shoulder blade to the thoracic spine there, they can't function optimally. So something else has to pick up the slack when you're moving your arm up, especially overhead, and that's the biceps. So we have weakness in the muscles of the rotator cuff and the scapulothoracic joint, such as serratus anterior and the rhomboids. We've got poor posture, and we've also got poor alignment of the scapula and or the glenohumeral joint. So if your shoulder is sitting like this, but you've got perfect thoracic spine posture, again, the muscles, the rotator cuff, the scapulothoracic muscles, they can't work optimally, and the biceps will compensate to pick up the slack, and eventually it'll wear out. Now, with those root causes in mind, should we get surgery? First, you should understand what the surgery is. There's 2 main types. One is they'll cut off the biceps tendon from the bone and just let it hang and hopefully heal properly. And 2 is they'll cut the tendon and then they'll reattach the tendon with staples, screws, sutures. Now think about it. If the root cause is poor thoracic spine posture, is cutting the tendon and reattaching it gonna help? If it's weak rotator cuff muscles, same thing, is it gonna help? The answer is no. That's why surgeries of these type often fail months or years after you get them. So what is the solution? Well, the solution to address those root causes is through exercise. It's through restoring good alignment and posture. It's through strengthening those muscles and then recreating proper movement patterns so you use the right muscles when you're moving around. And that's what we're gonna do with these 4 exercises. The first exercise is one of my new favorite techniques to address poor thoracic spine posture. I call it the stability ball SB thoracic extension. What's important is the setup. So you're gonna lie down, stomach on the ball, and you wanna bring your legs to under the ball. And for lack of a better description, you're basically humping the ball. So you kind of push your pelvis into the ball. The reason why we're doing this is because we wanna round the lumbar spine and posteriorly tilt the pelvis. So that's number 1, hump the ball. Number 2 is you're gonna lie over the ball, really relax, just have your hand on the ball here, and you wanna look up and forward in front of you. Now what you do, that's the setup position, you lift your chest off the ball as you simultaneously look down towards the ball and think of lengthening your neck and your head, as if there's a string pulling my head that way. The goal here is to activate the deep muscles around the thoracic spine called the multifidus, and wake those guys up and hold it and get them strong. So I'm holding, I'm breathing naturally, still kind of humping the ball here. Holding, breathing, and then lowering down, relaxing everything, and returning to the start position. Now I don't want to squeeze my shoulder blades together to activate the rhomboids. What I'm trying to do is isolate those multifidus muscles. So I'm keeping the hands relaxed again. I'll do 1 more rep. So I'm kind of thrusting into the ball a little bit, looking up, and then I lift my chest off the ball and just think of extending my thoracic spine, lengthening through my neck and my cervical spine, and waking up those deep muscles that are just around the spine there. So I keep everything from the thoracic spine down, rounded, flexed. That way we're isolating at the thoracic spine. Holding, breathing naturally, and then I relax everything. Might do a few more reps when you're gone. But this exercise is wonderful for getting those deep multifidus muscles activated, and when you hold and when you try to keep getting deeper into that range of motion by extending every little joint through the thoracic spine from the bottom of your neck down to the start of your low back, you're gonna wake those muscles up and you're gonna get them strong, and that's gonna allow you to keep good posture effortlessly all day long. These are the muscles that are key. Just trying to stand up straight and pull your shoulders back like a military posture will never work because you'll never be able to hold it all day. So do this exercise. This sets the foundation for your whole shoulder joint to work properly. Now that we've gotten that out of the way, the second exercise is still my favorite exercise for not only getting the serratus anterior working well, but also co-contracting the lower trapezius and the rhomboids. And that's the Slumpy Serratus Activator technique. For this exercise, you start off in poor slumpy posture. So this teaches you to get out of this posture. That's one of the benefits of the exercise. So my head's forward and I just look terrible. From here, I straighten everything up as I reach my arms back behind me and internally rotate at the shoulders. From here, I'm thinking of pulling my shoulder blades together and then tucking my shoulder blades in towards my rib cage. I'm going to show you the anterior or the posterior scapular tilt movement in a second. So I'm posteriorly scapular tilting, I'm squeezing my shoulder blades together, and I'm getting tall and I'm rolling my shoulders right back. When I'm done, I maintain tension through all the shoulder muscles as I return my hands to the neutral position and then hold good posture as I gradually let everything go. And this helps to integrate this good posture and position into my nervous system. So the most important cue there is one that you really can't see too much, and that's the posterior tilt of the scapula or the shoulder blade. So I'm pulling the bottom edge of my shoulder blade in towards my rib cage. So again, this is what the exercise looks like. Really bad posture, horrible posture. And then I straighten up slowly, pulling my chin in, getting tall, and internally rotating the shoulders. So the shoulders are rotating like so. As I try to lift my hands away from the ground, pinch my shoulder blades together, and posteriorly tilt that scapula. Tuck that shoulder blade, the bottom edge, into the rib cage. And as I'm holding, I'm trying to do all of those things, trying to get deeper into every range. Lifting up, internally rotating, squeezing together, and posteriorly tilting. I maintain the tension in all those muscles, return to neutral, and then let everything go and keep that good posture. Now there's one more cue that you want to be aware of as you do this exercise. So again, bad posture, straighten up, get nice and tall, internally rotate, squeeze the shoulder blades together, posteriorly tilt, and I don't want to let my shoulders hike up. I want to keep my shoulders down, away from my ears. Maintain the tension, return to neutral, and that good shoulder alignment is now yours. Now we're moving on to the third exercise, which is going to target the subscapularis muscle, one of those rotator cuffs, and the only one that performs the function of internal rotation. So internal rotation is like that. This exercise is similar to one that you've probably seen before if you've been on a shoulder rehab journey, which is the face pull, but it's kind of like the opposite of the face pull. For this technique, you want to bend, set up about face level. And throughout this exercise, I want to keep my wrists in neutral. I don't want to flex my wrists or extend my wrists. I want to keep them straight and in neutral position. From here, I start with my hands in line with the bands and in line with my face and lift them up just a little bit, so above that level. From here, I'm going to perform a row with my elbows out wide as I bring my hands below the level of my elbow. And that's where you get a little bit of internal rotation there. I reverse the motion to the beginning and again. What I'm trying to focus on is pinching my shoulder blades together, keeping my wrists straight, and keeping my shoulders down while bringing my hand below the level of my elbow. So it's my hands above my elbow, and then my hand is below my level. With all those other cues, shoulders down, pinching the shoulder blades together, and keeping the wrists straight. Go nice and slow, just like that. And we don't need a ton of resistance on the band there. We're just trying to get good activation so that we train all of the rotator cuff muscles to work together. You need the internal rotation component, that subscapularis. When you're doing any movements like rows or pushes, you need that muscle to be contributing to the overall stability of that glenohumeral joint. So this is a great technique to wake up this muscle that's often under-recruited and weak because we've got such strong internal rotators like the pecs and the lats that often take over from it. The fourth and final exercise I've got for you is going to target the external rotators of the shoulder joint, but it's also going to target overall stability of the shoulder. And that's the 4-point ER row. For this exercise, I'm going to show you the beginner version first, and then I'm going to show you the version you can hopefully progress to and build some more strength with. The first version is on 4-point hands and knees. So I set up here, and I want to get myself in good alignment of the spine. So I've got a natural curve at the lumbar spine. My chin is tucked. I'm lengthened through the neck, and my shoulder blades are not fully pinched together and not fully pushed away. I'm right in the neutral position of the shoulder blades there, and I keep my shoulders down away from my ears. Now that I've got the setup, for this version, all I'm doing is I'm lifting off the affected arm, and I'm doing kind of like a row and an external rotation. Holding here for 5 seconds. This version is going to target the teres minor muscle that's part of the external rotator group. And then I lower it down. In the second version, I'm doing rowing plus external rotation with my arm out. And this targets more the infraspinatus muscle. Hold that for 5 seconds and then return. I alternate between the two, elbow tucked by my side for the teres minor, holding for 5, keeping good positioning of the spine. So nothing else is moving. The only thing that's moving is my arm. And here I'm trying to get deeper. I'm trying to lift the arm away from the floor and externally rotate even though nothing is moving, only for 5 seconds. So that right there, you do 1 rep is 1 of each, elbow by side and elbow out. Then do both sides just for balance, because this 4-point position, when I'm on one arm, this forces this shoulder to stabilize. Now the progression to all this, if you want to build some strength, you're not in the acute phases, maybe 2 or 4 weeks after just doing the 4-point version, is the push-up position. So same thing, get yourself in good alignment. And now we're doing row, elbow in with the external rotation, hold for 5. You might have to spread your feet a little wider. Return, touch, row, external rotation with the elbow out. Holding for 5 and returning. And here we've got just a much greater demand for stability on the shoulder as well as through the core. We're getting some anti-rotational stability training through the core, which is just good for everybody to do, but especially for any athletes involved in sports like baseball, hockey, tennis. Anytime you have to rotate, we need this connection between the core and the shoulder to be strong and to be working well. To recap the 4 exercises we went through today, we've got the SB thoracic extension. For this technique, do 2 sets of 3 to 5 reps, holding each rep for 10 seconds. Next, we did the Slumpy Serratus Activator. Perform this for 2 to 3 sets of 4 to 6 reps, holding each for about 10 seconds. The third exercise to hit the subscapularis was the internal rotation, the IR row. For this technique, do 2 to 3 sets of 8 to 12 reps. Finally, we just finished off with the 4-point ER row. Do this for 2 to 3 sets of 3 to 5 reps per side, holding each rep for 5 seconds. Do this routine 2 to 3 times a week for at least 4 weeks and up to 6 weeks, and you'll find great relief in your proximal biceps tendinopathy. So there you're now armed with 4 great exercises to address all of the common root causes for proximal biceps tendinopathy. And perhaps more importantly is you've got an actual understanding of what is going wrong. So if you've been stuck for a while, you've been feeling lost, you've been frustrated because rubbing, massaging, stretching hasn't worked, now you've got a path forward. And this is what we do. We lay out the science, the actual root causes, and give you practical exercises that you can do at home, because that's how you can be most consistent and that's how you're going to get results. Now, I definitely suggest you try this out, and I'm guessing you'll find some relief from it. And if you want to take it further, then you should definitely follow the shoulder pain solution program that you could find in our ROM Coach app. And we'll link that here. And if you want to dive in to the YouTube rabbit hole a little bit more to see some other exercises, then check out these other videos here and here. Thanks for watching, and I'll see you next time. Peace.